If you're in your first trimester, you might be thinking to yourself, I don't need to worry about my pelvic floor. That's for birth or postpartum recovery. But honestly, as a pelvic floor physical therapist myself, I start having my patients work on their pelvic floor as soon as they find out they are pregnant, if not beforehand. Because in reality, your pelvic floor and your body start going through physiological changes the moment you become pregnant. So even though your bump might still be small or even non-existent at this point, there's so many things that you can start doing to prepare your body for birth and postpartum recovery in the first trimester to set the tone for your entire pregnancy. So today we're going to talk about 4 things I want you to start doing the moment you find out you are pregnant. But first, it's important to note these 2 major things that happen in your body the moment you find out you are pregnant. The first is you have an increase in different hormones called relaxin, progesterone, and estrogen. The combination of these hormones increase the laxity of your ligaments and muscles, meaning that your body just has a lot more mobility in your pelvis. Increased mobility often means decreased stability, which can lead to a lot more pain because your body is not used to having so much movement and mobility. This is why strength training is one of the best things that you can do for your body to improve muscular support of your pelvis and full body to counteract that increased mobility. The second important physiological change is that your blood volume is already increasing the moment you find out you are pregnant. More blood volume simply means more fluid that your body is going to have to regulate. And your pelvic floor muscles, when they contract and relax, play an important role in returning blood and lymph from your pelvis and abdominal region back to your heart. So with this increase in tissue elasticity and blood volume, your pelvic floor is already undergoing significant change that deserves attention now. So the first thing that I want you to start doing in your first trimester is just learn what your pelvic floor is. Your pelvic floor is a group of muscles that sit at the base of your pelvis, and they attach from the pubic bone in the front to the tailbone in the back, and then to the sits bones on either side. They basically sit at the bottom of your pelvis like a bowl or a hammock or a sling, and they support your pelvic floor organs as well as play an important role in sexual health, bladder and bowel control, stability, and so much more. You can understand why it's important to address your pelvic floor, because if your pelvic organs sit directly on your pelvic floor, that means that pelvic floor is going to undergo a lot of stress because your uterus is one of your pelvic organs that sits on the pelvic floor, is going to be growing during pregnancy with your baby. And that's going to place a lot of pressure on your pelvic floor. So just learning what these muscles are, what roles they play, can empower you with knowledge to know when you're experiencing dysfunction during pregnancy. The second thing that I want you to start doing in your first trimester is learn how to both contract and relax your pelvic floor. Oftentimes, women are told to perform Kegels to strengthen their pelvic floor, but traditionally, a Kegel only talks about that contraction part of the pelvic floor, but your pelvic floor also needs to relax, just like any other muscle in your body. For instance, your bicep, right? You need to be able to contract it as well as relax it. Traditionally, your pelvic floor muscles must relax, lengthen, and descend on an inhale, and then on an exhale, they will gently lift up, depending on how much you are contracting them or what stressful event is going on. Remember, during pregnancy, a healthy pelvic floor is one that can fully contract and fully relax through its full range of motion, coordinated with your breath and full body movement. The third thing that I want you to do in your first trimester is learning how to engage your deep core. Your deep core is called your transverse abdominis muscles, and the muscle fibers run horizontally, and when they contract, they actually act as a corset to better stabilize your spine. During pregnancy, your abdominals will lengthen a ton as your belly grows, and learning how to properly engage those muscles is going to provide better support to you and your baby. It becomes really important the larger your belly grows to learn how to engage your deep core to also reduce pain during everyday activities, just like bending over or picking something up off of the ground. So let's practice how to engage your deep core. Start in a comfortable sitting position with your hands on either side of your rib cage. So your fingertips are in the front and your thumb pads are in the back. On an inhale, you're going to inhale and try and expand your ribs 360 degrees into your hands. And then exhale, just let it go. Notice how your belly and chest, lower back, and pelvic floor should all expand on that inhale. Let's try one more time, just focusing on the inhale. And exhale, just let it go. Now we add in that deep core contraction. What this will look like, or what you will think about doing, is you inhale and expand, and then on an exhale, you're going to imagine you are contracting and lifting your pelvic floor up and in. I like to use the analogy of that claw hand in those old vending machines where you would contract or grab some sort of toy out of the vending machine and then lifts it up and in. Another analogy that sometimes helps is imagine there is a Kleenex that is flat on the ground and you pick it up with just your 2 fingers, and as you pick it up and lift it, you see how it narrows and lifts up and in. So inhale, expand. Exhale, contract and gently lift your pelvic floor up and in as you exhale. Once you've mastered that contraction and lift of the pelvic floor, we're going to layer in that deep transverse abdominis muscle. So you start with that lift up and in, then you work your way from the lower core all the way up to your ribs. A common mistake I see is people will engage their core from the top down and almost crunch downwards like this. And you can see that creates a lot of pooching at the lower abdominals. You want to stay up nice and tall. And when you inhale and then exhale, gently lift up and in, and imagine you're zippering up your core from the bottom up. Another cue that's really helpful to engage the lower transverse abdominis is imagine you had 2 headlights on your hip bones and you're actually trying to point them towards one another. And that's going to help you engage that lower core first. And then at the very end, the ribs come down and in. So let's put it all together. Big inhale into the ribs, expand 360 degrees. Exhale, gently lift the pelvic floor up and in. Then start zippering up your core. Imagine those 2 headlights on your hip bones pointing towards one another. Ribs come down and in at the very end. The reason why I want you to start working on this now is because you can probably notice how difficult that might have felt, or felt like it was a lot of moving parts and pieces. So the earlier you can start working on that deep core contraction, the better, because it's only going to get harder the larger your belly gets, the more lengthened your abdominals and pelvic floor become. And you need that deep core contraction, not just during pregnancy, but also to help with postpartum recovery. And my 4th and final tip is to start building foundational strength of your full body integrated with your pelvic floor. I know the first trimester is exhausting and you might be nauseous and feel like you have no room to give anymore, which is why your workouts don't need to be an hour long. Honestly, even just doing a quick 5-minute warm up, maybe 1 circuit of strength training and then go to your cool down is enough. And it also doesn't need to be super heavyweight in this first trimester. Just do whatever you can and whatever feels appropriate based off of how you are feeling that day. So remember, preparing your pelvic floor in the first trimester is not just about doing a million Kegels, it's about connection and awareness and building that strong foundation. If you want more guidance on how to appropriately exercise while caring for your pelvic floor during pregnancy, join my Movement Through Pregnancy program, which is a 37-week prenatal strength training program with fully guided classes, with me walking you through every single exercise so you know exactly what to do and how to do it. If you found this video helpful, please make sure to like and subscribe and let me know what you want to see more of related to pregnancy, postpartum, and pelvic floor education.